Welcome. This is the fourth part of our Maintain Your Brain series. And today we are talking about understanding Alzheimer's and dementia, brought to you by the Alzheimer's Association and Cynthia Perthuis. She is our speaker today. But once again, my name is Felicia Saraceno. I'm the Director of Business Development here at the Arlington of Naples. And we have everything here at the Arlington. We're a life plan community. So we have residential living, and we have assisted living, memory care, and we have a wonderful skilled nursing rehab right here on site in Naples. We're located in the Lely Resort. But I'm going to turn it over to Cynthia. Thank you so much for joining us today.
Thank you. Thanks so much, Felicia. So I'm Cynthia Perthuis, and I do work I have a company that's called Senior Care Authority, and what we do is we help clients figure out what their next steps are, whether they're going to go live at the Arlington or whether they're going to stay at home and live at home. We try to help that work for them as well. I am a dementia specialist, and I come to this from a genetic standpoint, as in I had relatives, my grandmother, my father, all had Alzheimer's, and so I have done a lot of study on that. And today we're going to talk about understanding Alzheimer's. Alzheimer's is a word that, I remember when they used to call it old timers disease, or we would call it senility. And so today we're going to learn a little bit more about Alzheimer's disease as a whole so that you can understand that. And I'm going to put on my slides here, and we're going to be off to the races. I see some familiar faces who we've seen in some other sessions that we've had, and I am glad to see you all, and I'm glad to see some new faces as well. So let's see if I can get this where it's supposed to be. Here we go. Great. So again, we're going to talk about understanding Alzheimer's and dementia and some of those differences there. And while we're talking, we're going to also talk about not only our people, our friends, our loved ones, our clients, if you will, who have Alzheimer's and dementia, but we're going to talk about the caregivers too, and what are some of the things and how we can help the caregivers. Today, we want to understand Alzheimer's and dementia. So we're going to look at the differences between what those two words even mean. And we want to recognize how it affects the brain. We want to understand the risk factors of Alzheimer's disease. We're going to look at the 3 stages of the disease, and we're going to look at some treatments that address the symptoms. Again, not the disease itself, but the symptoms of the disease. And we're going to learn how the scientists are working to advance that research. And I'm here under the kind generosity of the Alzheimer's Association, who has trained me, and I do a lot of these presentations for them. And we're going to talk about the Alzheimer's Association and how that can help support people who have Alzheimer's as well as their family and their caregivers. I'd like for you to understand that Alzheimer's is a global crisis. And you are likely beginning to hear more and more about it in your personal lives and on the news. But let's start off by seeing what you know about the impact of Alzheimer's. So we're just going to do a little test here. How many Americans do you think are living with the disease today? We know it's a lot. But what do you think is the number? So just in your own head or on a piece of paper, just write down what number you think are currently living with Alzheimer's. And I'm going to tell you that there are 5.8 million people in America that are living with Alzheimer's. And barring any developments in prevention or treatment methods, this number is projected to reach 14 million by the year 2050. Now, I plan to be still around in 2050, and I also don't plan to have any Alzheimer's. So we want to think about what are we going to be able to do to stop this massive growth of this disease. Currently, an estimated 50 million people worldwide are living with dementia. Now, again, we're going to have a discussion in a minute about the difference between those two words, Alzheimer's and dementia. But 50 million people in the world are living with dementia. So let's look at another question. How many unpaid Alzheimer's caregivers are there in the United States? So remember, we have this 5.8 million people who have Alzheimer's. How many unpaid caregivers does it take to take care of those 5.8 million people? Currently, there are 16.2 million Americans that are providing unpaid care for people with Alzheimer's or another dementia. Alzheimer's impacts caregivers both at home and at work. More than 80% of care provided at home is delivered by family members. It may be a sister, it may be a mother, it may be a spouse, or by friends or other unpaid caregivers. Maybe it's the neighbor. Over half of the employed caregivers report having to go in late to work, take time off, or quit their job altogether. These caregivers provided approximately 18.4 billion hours of care last year, valued at more than, this number is just mind-boggling, $232 billion. So if these unpaid caregivers had been paid, it would have cost $232 billion. So as you can see, this disease takes a personal impact, takes a personal impact on the individuals facing it as well as a financial impact. So let's learn a few more stats about the impact of Alzheimer's. Now, I have to believe that some of these facts and statistics were very surprising to you. What I also find about them is they're very sobering to me. I've seen these facts and figures in my work, but they're very sobering to me. These are big numbers, and this is a big problem. Now, you, as we've talked about a little bit earlier, you may hear these terms Alzheimer's and dementia used interchangeably. Now, they're related, but they're very different. So in the next section, we're going to discuss both Alzheimer's and dementia and how they're related. So let's listen, let's test one more test before we go. Alzheimer's is a normal part of the aging process. Do you think that Alzheimer's is a normal part of the aging process? Alzheimer's, we need to know, is more than memory loss. It's a progressive and fatal disease that kills nerve cells and tissues in the brain, and it is not a normal part of the aging process. It affects an individual's ability to remember, to think, to plan, and to ultimately function. One more test. People younger than age 65 can get Alzheimer's. This is true, very true. Approximately 200,000 Americans younger than age 65 are living with younger onset Alzheimer's disease. And in some cases, people develop the disease in their 40s or 50s. We're going to listen to a video with one of our experts, and she's going to explain to us how Alzheimer's and dementia are related.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow and the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
So one of the things that we want to think about is, again, Alzheimer's and dementia are two separate things. Alzheimer's is under that umbrella of dementia, and that umbrella of dementia has about 31 different types of dementia, different causes for those different types, different diagnoses for those different types. And so we want to be using those phrases correctly. Now, dementia is a normal part of aging, but about 60 to 80% of all dementia cases are caused by Alzheimer's disease. So let's find out, if you're trying to get a diagnosis, why would an accurate diagnosis, why is that important to know the different types of dementia? Why is it important to know which type of dementia you have?
Certainly having the diagnosis of Lewy body was helpful in our planning because we began to understand where this was coming from in the brain, where otherwise we would not have known. Like we knew something was happening, but what was it? To give it a label actually helped, although it was a big umbrella. It explains some of the characteristics and symptoms that we were experiencing and seeing.
So again, it's good to put an actual name and an actual accurate diagnosis so that you can know about the treatment and you can know what your next steps should be. Just as a recap, dementia is a general term for the collection of symptoms that are severe enough to interfere with our daily life. And Alzheimer's is the most common cause of dementia. Now, I mentioned it earlier, but I'm going to say it again. Alzheimer's is not a normal part of aging. It's a progressive brain disease. Now, next, we're going to look at what goes on in the brain with an Alzheimer's patient. Remember, as we discussed, it's a brain disease, and the brain is our most complex organ. It only weighs about 3.5 pounds, but that small little 3.5 pounds out of our big bodies is very important and very complex, and it's also very powerful. So let's hear about how Alzheimer's affects the brain.
More than 100 years ago, Dr. Alois Alzheimer's described specific changes in the brain, what we call the formation of plaques and tangles. Now, Alzheimer's is a progressive brain disease that's marked by these key changes and is thought to impact memory, thinking, and behavior. The brain has three main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. The cerebrum fills up most of your skull. It is part of the brain most involved in remembering, problem solving, thinking, and even feelings. There are about 100 billion nerve cells or neurons throughout the brain that transmit messages in order for us to create memories, feelings, and thoughts. Alzheimer's disease causes nerve cells to die, which leads to the brain tissue loss, or what we call shrinkage, and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's disease, such as memory loss, problems with thinking, planning, behavioral issues, and even at the end stages, problems with swallowing.
Now, in this next module, we're going to talk about the risk factors. And I don't know about you, but that was very important for me. I wanted to know what were the risk factors? What risk did I have? Being in a family that had Alzheimer's, being someone who's growing older every day, what are the risks? And everyone who has a brain is at risk of developing Alzheimer's disease. You don't have to have these other, you don't have to have genetics, you don't have to have, as I do, my father dying with it. Everyone who has a brain is at risk. But there are some known factors that increase a person's risk of developing Alzheimer's disease. So let's go through some of those lists and see if what we might have. And again, we're learning about our brains, so we're going to take another little test. What is the greatest known risk factor for Alzheimer's disease? Is it genetics? No. Is it family history? No. It's age. All of these are risk factors, genetics, family history, but age is the greatest known risk factor. Again, Alzheimer's is not a normal part of aging, but it is a risk factor. So let's hear about why that might be a risk factor.
Alzheimer's disease is marked by specific brain changes that result in the clinical changes in individual experiences. That is, changes in memory, thinking, or reasoning. And ultimately, Alzheimer's is fatal. The exact cause for these changes is unknown, but there are some hints as to what may contribute to an individual's risk. Age is the greatest known risk factor for Alzheimer's. And when we look at populations of people, we see an increased risk over the age of 65. However, Alzheimer's is not normal aging. Family history is also a known risk factor. Research has shown that those who have a parent or a sibling with Alzheimer's are more likely to develop the disease, and that risk increases if more than one family member has Alzheimer's. When we talk about the genes involved in Alzheimer's, there are two categories that could potentially be involved: risk genes and deterministic genes. Risk genes increases an individual's risk for developing the disease, but does not guarantee that they will develop Alzheimer's. Deterministic genes, which are rare for Alzheimer's, guarantee that the person will develop the disease.
Now, there are some populations that are at higher risk than the general populations. So Hispanics, African Americans, and women are at a higher risk for dementia. Research shows that older Hispanics are about 1.5 times as likely as older whites to develop Alzheimer's and other dementias, while older African Americans are about twice as likely to develop the disease as older whites. Now, the reason for these differences is not really well understood, but researchers believe that higher rates of vascular disease in these groups may also put them at greater risk for developing Alzheimer's. Women are more likely than men to develop the disease. An estimated 3.4 million American women are living with the disease today. Remember, there's 5.8 million total population, and 3.4 million of those are women. We know that women live longer than men, making them more likely to develop Alzheimer's. However, longevity and lower death rates can only partially explain this difference. And researchers are exploring how genetic differences between men and women may impact disease risk. So again, just as a recap and to summarize, Alzheimer's disease involves the failure of nerve cells, the exact cause of which is still uncertain. However, research has identified risk factors that increase the likelihood of developing Alzheimer's. Age is the greatest known risk factor for Alzheimer's, as individuals' risk for developing the disease increases at age 65. Family history is also a known risk factor. Having a parent or a sibling with the disease increases an individual's risk. Again, doesn't guarantee that that individual will have it, but it increases their risk factor. The types of genes, or two types of genes, are associated with Alzheimer's. Remember, the risk genes and the deterministic genes. Hispanics, African Americans, and women are at an increased risk for developing Alzheimer's. Next, we're going to talk about the stages of Alzheimer's disease. Know that no two individuals experience the symptoms and progression of Alzheimer's disease in the exact same way. We're going to hear from another expert on why this is the case, as well as from some individuals that describe what it's like to live in the early stages of Alzheimer's disease.
One of the things that impacts our brain is all the other things that can happen to us as we age. And we know that Alzheimer's, the most common risk factor for getting Alzheimer's disease is age. But we also have lots of other things that go wrong with us as we age. And so how those other health factors impact our brain can also impact how Alzheimer's presents in other people.
So let's just hear from a couple of people about what it feels like to have Alzheimer's.
It's a different kind of forgetting. It really, really is. It's not just forgetting where I put my car keys. It's much deeper than that. And for example, I cannot read a book. I used to be a voracious reader because by the time I turn a page, I have forgotten what I had read. And if you're reading a novel, you have to know what transpired before it in order for you to continue to read on. And so I can't read a novel. So I've even stopped trying.
Math, I can't do a simple tip anymore. You know, I sit there, I stare at it. It's crazy what numbers I can't deal with anymore. And in some ways, that's the disease to me. The other thing that I've increasingly been struggling with are words, which I've dealt with words my entire life. You know, as an avid reader, as a reporter, as a writer. I struggle with them now.
I'm like an overachiever and when you're unable to deliver or you're not performing at the same pace that you once did before, that's frustrating. It's frustrating to not know where you place things. It's frustrating to not be able to explain to someone the problems that you're having. You can't articulate it in a way. It's frustrating to read something and you forgot what you read. It's frustrating to continuously have to change your password and you just changed it last week and you're constantly doing the same thing over and over again.
I think the thing that surprises me the most about my dementia is that it is progressive. And I'm finding that I'm forgetting more. And they do memory tests for me all the time at the doctor. And so that becomes a little disconcerting at times to see my cognitive impairment continue to decline. But again, I really have hope. I don't live really in the future. I can't live in the future. I can't worry about what the future is going to bring. I have to live for today.
Now, all of these individuals that we heard from are living in the early stages of the disease. Symptoms worsen over time for everyone who has this disease, but people go through at different rates. And their abilities change differently. So again, not anyone who has it is the same. On average, a person with Alzheimer's lives 4 to 8 years after the diagnosis, but they can live as long as 20 years after a diagnosis. Let's hear about the 3 different stages of Alzheimer's.
Alzheimer's affects everyone differently. As a result, it's difficult to place a person in a specific stage of the disease. However, there are 3 general stages that are commonly referred to as early, middle, and late stage Alzheimer's. In a medical context, you may hear these stages referred to as mild, moderate, and severe. In the early stage of Alzheimer's, an individual may be able to function independently. However, they may start noticing more frequent memory lapses. Friends and family may also begin to notice difficulties in the person, and a healthcare provider may be able to detect problems in memory or concentration by conducting a detailed medical interview. Middle stage Alzheimer's is typically the longest stage and can last for many years. Damage to the brain cells can make it difficult to express thoughts and perform routine tasks, and this can lead to increased feelings of frustration and anger. In the final stage of the disease, an individual loses the ability to hold a conversation, control their movements, or respond to the environment around them. Cognitive skills, that is, their memory, thinking, and reasoning skills, continue to decline, and this can lead to personality changes and need for round-the-clock care.
So we're going to talk about this a little bit later too, but just as a reminder, in this early stage of Alzheimer's, it's not about that you forget where your keys are or that you forget to get milk at the grocery store. It's having memory lapses that affect your functioning as a human being and affects the way that you can't cook a meal because you cannot understand or remember a recipe or how to make it or how to divide it or how to what these different ingredients are. Those are the things that are concerning and that are Alzheimer's-like as well, but are not things like, oh, I forgot where I placed my keys. One of the things that our expert talked about are these three stages: early stage, middle stage, late stage. These are not to be confused with early onset. So early onset, the word onset, is someone who has Alzheimer's diagnosed pre-65 years. That's not the same as early stage. So sometimes I will have clients who come to me and their loved one, their spouse is 95 years old, and they will say, oh, he has developed early onset Alzheimer's. No, he's in the early stages of Alzheimer's. So I like to make sure that we understand the value of words and that we're using our words correctly around this disease. It's important to remember that these stages are general, and because each person has a unique experience, we cannot always neatly place people into these specific stages. In fact, some people exhibit symptoms from early and middle and late all at the same time. As Alzheimer's disease progresses, the individual's behavior will change, as does the role of the caregiver. These stages can help caregivers prepare for what to expect and understand and how best to respond. Again, we've recapped this a little bit, but I like to tell you 2 or 3 times so that we can all remember. There's 3 stages of Alzheimer's disease: early, middle, and late. And they are referred to as mild, moderate, and severe. No 2 individuals are the same. And while they worsen, they progress through at different rates as their abilities change. Let's talk about some treatment for the symptoms. I just gave you a little clue here for our next test that we're going to have. True or false? There are several drugs available to slow down the progression of Alzheimer's disease. And the answer to that is false. There are not drugs that will slow down the progression, but there are drugs that will slow down, that will help with the symptoms. There's no treatment to prevent, treat, or slow Alzheimer's, but there are treatments and drugs available to address some of the symptoms. So again, this statement is false. There are not drugs to slow the progression, just drugs to treat the symptoms.
There are currently several drugs that are FDA approved to treat the cognitive symptoms associated with Alzheimer's disease. They treat the symptoms, but they don't treat the underlying cause. So eventually people will progress, but they do treat some of the symptoms and help people for a time. So the first class of drugs are cholinesterase inhibitors. These drugs work to prevent the breakdown of acetylcholine, which is a chemical messenger found in the brain that's associated with learning and memory. There are 3 FDA-approved drugs that are in this class of drugs. There's Aricept, there's Exelon, and there's Razidine. There's another class of drugs that's modulates glutamate, which is another chemical messenger in the brain that's associated with learning and memory. And this drug is called Namenda. And then there's a final class, which is actually a combination of cholinesterase inhibitors and glutamate modulator, and this is called Namzaric.
One of the reasons it's so important to make sure that you have an accurate diagnosis is so that the doctors can look at the symptoms and figure out the exact treatment that would be the most effective for everyone. If they're treating something that they don't understand when you don't have an accurate diagnosis, it could be detrimental and it could have negative side effects. And these treatments are FDA approved. We'll talk about a little bit later things that are not FDA approved, but currently there are these 3 types of drugs that we talked about. And these are names that you may, if you are involved with a loved one who has Alzheimer's, you may have heard of these names: Aricept, Exelon, Razidine, Namenda, Namzaric. But they're only for the symptoms. Remember, they're not things that will cure the disease. Now, there are a lot of things in the last decade that have advanced the research. We've read a lot about them. Most recently, there was a blood test that was discussed maybe a couple of weeks ago. This presentation has not been updated to include that, so I can't really speak about it. But there are, they've made enormous strides in understanding how it affects the brain, which is the first step. Many recent insights point toward promising new strategies for treatment, prevention, and diagnosis.
This is an incredibly exciting time in Alzheimer's and dementia research. The advancements that we've made in the last decade to understand the disease as a continuum, meaning that the biological changes are starting a decade or more before someone is experiencing the changes in the memory and thinking. This sets the stage for possible prevention. The idea that when we have the tools to identify those individuals at the earliest time point, and when we have the interventions to target individuals at that earliest time point, we can intervene to stop or slow the progression of the disease before an individual loses their memories.
I'm excited about what we're learning these days regarding lifestyle. One of those things that we've seen in the past are things like exercise and nutrition have now started to gain more momentum to indicate to us that it can change your ability to slow cognitive decline. That is really the first stages of Alzheimer's disease. This may include things like social engagement, mental cognitive training. It can be things such as exercise. It can be nutrition. All those things are now starting to point that they will lower your risk for Alzheimer's disease.
A lot of hope does come from the Alzheimer's Association, all the research that is being done. Even though there is not a cure today for the disease, I know in my heart there is going to be a cure one day. And I know we're getting closer for that cure. Because even if you fail in a research study, you learn from that failure in the research study. That failure always brings progression.
It's nice to see the association spearheading in many ways the emphasis on getting the money at the federal level and at the private sector to get the research done so that someday there will be an effective treatment, hopefully cure, hopefully prevention.
Now, clinical studies are very, very important for a number of diseases, but they're also key to advancing Alzheimer's research. It's critical, especially critical, that people from diverse backgrounds participate in this research because they're at an increased risk of developing this disease. It's important that researchers are able to study large populations of these individuals to better understand the disease and their elevated vulnerability. Let's take a look at some of these different studies.
It's more important than ever for people to participate in clinical studies. The fact is, right now, we don't have an effective treatment to stop Alzheimer's disease. And if we don't have people participating in clinical trials, we never will. And so participating in a clinical study is one way that everyone can get involved in a very direct way in the fight against Alzheimer's disease. And for people who currently have dementia or Alzheimer's disease, there are some additional benefits. You get access to very close medical care. You also may be among the first people to have access to the treatments that will eventually prove to work.
Sometimes you hear the phrase, it's a failed trial. That means that it didn't hit the endpoint, it didn't achieve an FDA-approved drug. But I would say as a scientist, the only failed trial is one that doesn't give you valuable information. And if the trial is well designed, if it is a good scientific experiment, you get extremely valuable data so that you can plan the next trial and do the next study even better than the last one. And it gets you that much closer to that FDA-approved drug, to that effective treatment, and maybe someday even a cure.
Now we're going to hear a little bit about the Alzheimer's Association Trial Match Program.
Currently, more than 5 million Americans are living with Alzheimer's. By participating in clinical research, you can move us toward methods of treatment and prevention for all those affected by this devastating disease. Alzheimer's Association Trial Match is a free clinical studies matching service for those with dementia, caregivers, and healthy volunteers. To start, simply create a confidential user profile and receive a list of studies that may be a match for you. Don't just hope for a cure, help us find one.
So just to recap over what we talked about, scientists have increased their understanding of Alzheimer's significantly over the past decade, and they have been able to do that based on funding and trials. People with the disease, caregivers, and healthy individuals without dementia are needed to participate in clinical studies in order to find methods of prevention, treatment, and ultimately a cure. Both drug and non-drug studies are taking place across the country and online. Clinical studies may provide participants with cutting-edge treatment and additional medical care. Trial Match is a free clinical studies matching service for people interested in participating in Alzheimer's research. Alzheimer's is a difficult disease. However, no one has to face this disease alone. So let's talk about what the Alzheimer's Association does to help people who've been diagnosed with this disease. The Alzheimer's Association is in communities across the country, and it provides direct service to individuals and families facing the disease. Our mission at the Alzheimer's Association is to eliminate Alzheimer's disease through the advancement of research, to provide and enhance care and support for all those who are affected, and to reduce the risk of dementia through the promotion of brain health. Our vision is a world without Alzheimer's disease. The Alzheimer's Association is available 24/7. They're available 24/7 for questions, for support. There's a hotline. It's right here on this webpage, and it's 24/7. It has key resources that can help you. It is staffed all day and all night with master's level social workers. They provide access to highly trained and knowledgeable staff who can help you with education, decision-making support, crisis assistance, and resource identification. They are there around the clock to provide in-depth care consultations. It is free of charge. They will help you navigate services that are offered to families at any stage of the disease. Help is available in more than 200 languages. The website is alz.org. Now, there are also a number of different ways that you can help. You can volunteer, you can be an advocate, you can connect through the trial match, you can do some other fundraising activities such as Walk to End Alzheimer's. Volunteering, it can be as simple as just a few hours a week or more significant time commitment. I'm a volunteer for the Alzheimer's Association. I do these presentations and other things with them, and it just takes a couple of hours a week for me to be able to help and to support. Then there's advocacy, and the advocacy piece is about going to your political people that are in your space, whether it's local, whether it is statewide, whether it's national, and advocating and speaking out on behalf of the needs and the rights of those who have Alzheimer's disease. We heard about Trial Match a little bit earlier, and just going on to the alz.org/trial match, and it's an easy to use clinical studies matching service. I use Trial Match. I'm in the easiest trial that there is. I'd like to maybe do another one, but this one, once a year, I spend 45 minutes doing a memory test. And it's good for me, and it's good for the Alzheimer's Association, and it's easy. Then, of course, most of you probably know about the Walk to End Alzheimer's. We did it virtually this year, and we're hoping that we'll be able to do it non-virtually next year, as we're all hoping we can do non-virtual things. But in the meantime, it's a good way to raise funds, and it's the world's largest fundraiser to fight this disease. It's a global walk to end Alzheimer's. So now I'd like to open it up to questions. I'm going to stop sharing the screen so that I can see you all, because I love to look at you and pretend that we're all in a room together. So I'll stop sharing the screen, and feel free to unmute yourselves and ask any questions that you might have. Now, the mute is down on the left-hand side of your screen. If you hover down there and click on the little microphone, you can unmute yourself, or you can also type it in the chat if you would prefer to type in the chat your question. But if there are any questions, I am here to try to help you or to try to find the answer for you. Carol, you have a question.
So if he has not been diagnosed with Alzheimer's, mm-hmm. but he clearly has dementia. Mm-hmm. So what good does it do for me or us to know all about Alzheimer's when he has a different situation?
Well, it's important to get a diagnosis of what type of dementia. So as we talked about a little bit earlier, if you think about dementia as an umbrella, and under that umbrella are 31 different types of dementia. And if you can identify the type, it can help you with medications that you need to help with those symptoms. And it also can prepare you for what might be next. Some dementias, there's not a lot next. It's just, it is what it is today. Other dementias may show themselves and present themselves in hallucinations. Some dementias may present themselves with violent tendencies. If you have the diagnosis of exactly what type of dementia it is, it'll prepare you for what those next steps are. That's why it's important to talk to your primary care physician, who might recommend you to a neurologist, and run through a battery of tests to identify which one it is.
So it would be a neurologist that would decide the type of dementia?
Correct. A neurologist is the one who will be able to give you the tests that will be able to determine what type of dementia you have. And sometimes it may just be dementia that comes with aging.
My husband's dementia came with deafness.
Correct. You know, we've done another module in this series, and it's on some of the things that can cause dementia, and hearing loss can cause dementia. And that hearing loss is causing dementia because you're not hearing things and you become closed in on yourself, and your brain begins to deteriorate. And so that might not be Alzheimer's. It's just the dementia based on hearing loss.
Yeah. Thank you.
Mm-hmm. Other questions?
What is Lewy body?
Lewy bodies is a type of dementia that is traditionally matched up with Parkinson's disease. It's a side effect of Parkinson's, and Lewy bodies is a very difficult dementia in the fact that it can lead and in a lot of cases can lead to the hallucinations and the violence as it progresses down the path. It's a very difficult dementia.
What would be one of the early symptoms?
If you have a diagnosis of Parkinson's, that's an early sign that you could have Lewy bodies. And then the early symptoms are very similar to other dementia-related diseases: forgetfulness, loss of person and place. So not understanding, we've all driven our car and we've all gotten to a stoplight and said, oh, I think I missed where I was going to turn, or how did I get here? We've all done that. And that is can be related to stress. But if getting there, then someone says, I don't know where I am. I don't know why I'm in a car. I don't know where I'm going. That's a symptom of Lewy bodies and other dementias as well. But that's a symptom. And then the hallucinations, seeing things like seeing people who are no longer with us, people who have died, people who live in other places, but seeing them, not just talking about them repeatedly, but seeing them. Those are some early symptoms of Lewy bodies. Now, I see somebody who's talking, and your phone number is 853-718, but I don't know what your name is. But your mute is on. See, I'm going to send you a little note, see if I can unmute you. I can't unmute you. 853-718. And the mute button is on the left-hand side. There you are.
You got it.
I see you. You have a question? I saw you talking. Go ahead. Nope. Do we have any? Oh, there you are.
I have a question. Donepezil, the medication Donepezil, is treating what kind of dementia?
I am not a doctor. I'm so sorry. I can't answer that question. I don't know. I'm sorry.
Somebody in the family's taken it, and I'm wondering what it's to treat or what have you. So,
what symptom? You might.
Do you know if the medication is on trial, or is it an approved FDA medication?
I have to believe that it's approved by the FDA if you have a loved one who's taking it. I just don't know anything about it. I'm sorry. I would ask my doctor, or what I'm going to do when I finish is I'm going to go ask Dr. Google.
The little I know is that it's supposed to slow down. It doesn't cure, but it's supposed to slow down the progress. I don't know if that's correct or not.
I think that there is a fine line beside slow down the progress and just deal with those symptoms. Because you may feel like the progress is slowed if those symptoms are controlled. They can help people with their memory issues, but the progress is going. It's still going.
Thank you.
You're welcome. Other questions? Yes, Jim.
I've had several discussions with my doctor, who is also my friend's doctor. The reason I'm here is I have a female friend who is starting down the road, and I'm here to see what I can do to help her. But I've had 2 or 3 discussions with our doctor, and he said the medication that is out there is not real effective. He said some of it is absolutely worthless. There is a new medication coming shortly, but they don't put a lot of faith in it. They don't put a lot of stock in it. And that's just what his quotes were to me. And he's our resident GP.
I hear what you're saying. So when I went through this process with my father, the question that I would ask a doctor is, what's the best medicine? And he would say there is no best because it's for individuals. It has to do with their own chemical makeup. It has to do with what's going on with their disease. And for every person that says Aricept is amazing, I will tell you there's another person that says Aricept is not amazing. And so it has to do with that individual piece. And it also has to do with dosing, and it has to do with combinations of medications. So it's a whole big chemical experiment, but there is not, let's all go get this drug, it's the one. So your doctor friend is right in a way, because it is so individualized.
I understand. Oh.
Yeah.
I like what you said a while ago. The exercise and diet are so important, and it's important for everybody can do it, regardless of what situation they're in. If you stay stationary and don't move and watch TV all day, that's not a good situation at all for most things.
Well, it's very similar to, what we've seen with the pandemic and what we see with isolation and lack of exercise is that individuals who have Alzheimer's, as an example, they're getting worse, and they're getting worse for a variety of reasons. But some of those reasons are they're isolated. Some of those reasons are their medication is not being managed appropriately. Some of those reasons are they're not exercising. And so we don't know which one of those things is going to be what's going to help them the most, but we know that it's a cocktail. It's a cocktail of exercise, eating, social engagement, medication, outdoor activity. It's a cocktail. And those are some things we can control.
Does doing puzzles, cross, Sudoku, those kinds of brain exercises, would you highly recommend those things?
Well, I don't recommend anything. However, those items have been shown to be good of keeping things firing. Again, remember, if you have a diagnosis of Alzheimer's, they're not going to stop it, but they're things that are good to keep your brain firing. However, there's also research that shows that if you've been doing the crossword puzzle for the past 20 years, that there reaches a point where you've got to go find something new to do, because it's about new things in your brain. It's not about, I always do the crossword puzzle. It's about, I think I'm going to add Sudoku in, or I think I'm going to add words with friends in, something that causes your brain to stretch a little bit differently.
Excellent recommendation. Excellent.
Any other questions? Yes, Carol.
I thought this was going to be the brain health lecture. Have I missed that?
That was last week, but it's recorded. And so Felicia, I know, will send you an email with the link on it, Carol.
That would be.
It's my favorite. It's my favorite one that I do, because I am all about the brain and the body and eating right and exercising and social and outdoors. And so I love that one, because I believe that it's something we can all have control over, as you said. And there's some things that we can change about that.
Thank you.
So let me wrap up by telling you that, again, Felicia and I are here to help you in many different ways. And if you have any questions we will, hold on. I'm going to you have Felicia's information, I think. I'm going to put my information in the chat here. And I'm going to put my email address. If I can spell it right. And I'm also going to put my mobile phone number. And you feel free to just give either one of us a call or an email, and we'll see if we can answer more questions for you or give you direction. Or you can also call the Alzheimer's support line, which is somewhere. I'm going to have it. Maybe I don't. But you can go to alz.org. And they have an 800 number. They're 24/7. Felicia and I don't answer our phone 24/7. It feels like it sometimes, but it's not really 24/7. So alz.org is a really great place to provide you some information. So thank you, Felicia. And you're on mute, but I'm going to, there you go.
Thank you. Thank you so much, Cynthia. And, you know, for those of you who have been joining us throughout our Maintain Your Brain series, this is a theme that's been at each one of the events. So even when we go back to how to stimulate your brain, I remember Dr. Bendata talking about there was no difference between learning a new instrument and playing a piano or thinking about playing a new instrument and how your brain got stimulated. So if you want to review that one too, it's on our YouTube channel. We have Arlington of Naples YouTube channel. I'll feel free to send all of those out to you so you can get a chance to see them and review them, because there's tips on each of them, but they all have a really great common theme, and it's keeping that brain active and your body's active, which is important. And then of course,
and next week you have a really great one coming. Is it next week?
Yes, it is on the 18th. Different time though, so everyone's got to get used to it.
Tifa Snow.
Tifa Snow. She is going to be at 10:30 in the morning. Her main topic is really going to be talking about the 3 Ds for dementia, delirium, and depression. But she is going to be doing some questions and answers, and she is just a marvelous woman. I follow her on Facebook. She gives really quick live updates, 2-3 minutes a day. So you can always check her out. But we are featuring her. So if you're not signed up, which we have a lot of folks signed up, we would love for you to join us, because it's going to be the last event of our Maintain Your Brain series, but a really important one. But thank you, Cynthia, so much. These past 3 events that you have hosted for us have been so informative. I'm getting so much great feedback from our family members, residents, and folks who are joining us on here. So we thank you for your time and sharing your expertise.
Thank you. Thanks, everybody. Call us if you have any questions. Okay, stay safe. Be careful.
Have a wonderful day.
Thank you.
Thank you.